Today I'm here with Susan and I'm going to be showing you how to do a subcutaneous injection. A lot of you are on Semaglutide, which is injected subcutaneously. It comes in a little vial like this and it'll come frozen from the pharmacy. So it ships to your house. When you receive it, it's frozen. You want to put it in the freezer right away. And then when you're ready to do the injection, take it out about 30 minutes before or warm it up in your hands and let it thaw out so there's no ice. It's 100% liquid. There's also, if you forget, on the vial it tells you how to store it. Store in the freezer, has the name of the medication, and then it comes in a bag that has the information on with the dosing on it, in case you need to refer to any of those areas. So first I'm going to use B12 today for injection purposes or demonstration purposes, because it's easy to see and she's not on this med. So we're gonna give her a little energy today. So what you're gonna do, when you get this, it's gonna have a foil top on it. You just peel it off, throw it away. Every time you get it, every time you take it out to inject, you wanna clean off the hub with alcohol, because you're gonna be storing it in the freezer. You don't know what it was exposed to. Just clean it off really good. Scrub it with that alcohol swab. And then usually the starting dose is 10 units on the syringe. So it's the 10 on here. Your syringe is going to come like this with an orange cap on the bottom. You want to pull off the cap first, this cap right here. And in case you forgot to discard your needle or you put it on the counter and you forget if you've used it or not, you know that you used it because it doesn't have this cap on it. So first you want to pull back air. So it's going to start like this. You pull back to the 10 because this is glass. It's a closed system. And what you pull out, you have to replace with air that you put back in. So we're going to insert the needle into the vial just at 90 degrees when it's sitting on the counter. And then you're going to turn it upside down because then the needle's immersed in liquid. And when you pull back the plunger, you're getting liquid. So we're gonna pull back. You can pull a little bit further because you're getting some air and you wanna make sure there's no air in there. So then push back up to the 10, which is our dose. And if you have a tiny air bubble, it's okay, it's not gonna hurt you. Then we're going to swab off the injection site. So either lower belly, like where you can pinch some fat, or upper leg, the inside of the upper leg. So I'm going to first clean it off with alcohol. We know we have liquid in here because you can see from the distance from the 0 to 10, there's liquid. And then you just directly insert it at 90 degrees into the injection site. Push down the plunger until it doesn't go anymore, and then you pull the needle out and you're all done. So I'm going to show you with this one when you're injecting. You'll pretend there's liquid in here. We put it in at 90 degrees, push down on this, and then pull it out. When you're done with the needle, you can put it in an empty laundry detergent container, label it, say Sharps, and then tape it shut. You can throw it in the garbage. At least in Minnesota, it's legal to do that. Or you could bring it to a local pharmacy.